We have 2,469 cases of coronavirus in Victoria. That is 108 more than yesterday. The breakdown of those, and of course Annalise will be only too happy to take you through any further details that you might want, but at a top level, 14 are linked to controlled outbreaks, 25 are the result of routine testing, 69 of those cases are under investigation by our public health team. We have 509 active cases across Victoria yesterday, in what we believe is a record in single-day testing. 25,553 Victorians were tested, taking our total tests to 906,574 since the beginning of the year. 25 Victorians are in hospital. That number is slightly up, but we have 3 people in intensive care, and that number is down. Now, in terms of those numbers, what that essentially says to us is that we are doing more searching than we've ever done. That, of course, means that in accordance with the strategy, you find more and more cases, and you've got to then deal with the challenges that that throws up. Many thousands of close contacts, many thousands of Victorians who need to be monitored, who need to be supported in terms of quarantining at their homes. The challenge today is that we have got unacceptably high numbers in 2 further postcodes. And whilst it gives no one in the public health team nor the government any joy to have to announce that postcodes 3031 and 3051 will be the subject from 11:59 p.m. tonight of the stay-at-home order, where there is only those 4 permissible reasons to leave your home. Businesses in those affected suburbs and households will receive support in line with the other 10 postcodes, further to our announcement earlier in the week, and we'll provide any and all support that we can to those who are affected. Those entire postcodes are essentially added to the suburban lockdown from 11:59 p.m. tonight. Further, and this is in many respects the most challenging issue that we have dealt with throughout this entire global pandemic, 9 public housing towers in those postcodes will be the subject of a complete lockdown, effective immediately. Those residents, and I'll take you through the numbers in a moment, and Richard can give you a list of those 9 public housing towers. Given that there are positive cases in a number of those towers, and given the very high density of that nature of housing, the number of shared facilities, everything from laundries to obviously access and egress points, lifts, etc., the public health advice is to close those 9 towers. There will be no reason for any of those residents to leave their home for a period of at least 5 days, effective immediately. We don't take that step lightly. We know and understand that it is a big cohort. It is also a group of people, many of whom are amongst the most vulnerable in our Victorian community. But the risk to public health at a personal and family level, the health and well-being of those residents who all live very close to each other, the fact that there are positive cases in some of those towers and logical patterns of movement, friendship groups, family groups, mean that the best and most appropriate step is to be hard lockdown in those 9 towers. I again make the point that is effective immediately. Before I take you through the chain of command and the Victoria Police response to deliver that hard lockdown, let me just share with you some numbers as to those 9 towers. There are 1,345 units of housing within those 9 towers, and there are approximately 3,000 residents, that is adults as well as dependent children, that live in those 9 towers. So it is a very significant cohort, a very large group of people. The Minister will speak in more detail and give you the list, but we will provide any and all support to those impacted residents. There will be no one going in other than residents who are returning home, and no one will be allowed out of those public housing towers. There will be a massive logistical task to make sure that those people are fed, given the support that they need. I think we're equal to that task, and I don't for a moment underestimate how challenging, how traumatic in some respects that will be for those 3,000 residents. Richard can take you through some more detail in relation to the location of those towers and some of the support that we are looking to provide. Those matters are not quite settled yet. We'll have more to say about very targeted and specific support tomorrow.